It will be done by Dr. Chamindri Naotunna. She is a Senior Registrar in Pediatric Endocrinology, and I like to remind you that she's a proud alumni of Faculty of Medicine and Allied Sciences, and she has won the Best PGIM Student in Diploma MSc category in year 2017, and also she is the Best PGIM Gold Medalist for Best MD Student in the year 2022. So it is over to you, Dr. Chamindri. You can share the slides. Yes. Thank you so much.
Yeah. Can you see my screen?
Yes, yes, we can see your screen. Thank you.
Thank you, Dr. Parami, for that kind introduction. A very good afternoon to all the young budding doctors who are waiting to start their internship. So today I'm going to talk about the career opportunities at the Ministry of Health, Sri Lanka. And also I am supposed to talk about how to be a successful medical officer or an administrative officer, and the importance of continuous medical education and CPD. And I will briefly describe about the role of the doctor at the forces as well. So once you finish your one-year internship, you will be promoted to the preliminary grade medical officer. So once you are in the preliminary grade medical officer for 2 years duration, and after the successful completion of the efficiency bar examination, at the end of the 2 years, you will be promoted for the grade 2 medical officer. After being a grade 2 medical officer, there are 2 pathways that you can follow to become a grade 1 medical officer. If you do any sort of postgraduate qualification, either a diploma, MSc, or an MD stream from the Postgraduate Institute of Medicine, 6 years from the date of grade 2 medical officer, you can become a grade 1 medical officer. But if you do not have any postgraduate qualifications, then you have to wait for 12 years to obtain these postgraduate qualifications. And then just at any point of this point, you can do postgraduate studies and be a specialized consultant in Sri Lanka. I just want to share these statistics with you all to show the number of medical students in each of the university. This is from the 2007 A-level batch, that is from my batch, and the MD students at each university. So in University of Colombo, the total number of students from the 2007 batch were around 200, and more than 100 of them are now senior registrars, acting consultants, or registrars. In University of Jayawardenepura, there were 150 students, and around 30 students are like that, doing any postgraduate studies. And in University of Jaffna, there were 67 students, and 47 of them are doing some sort of postgraduate training to become a consultant. And in University of Kelaniya, there were 170 students, and 25 of them are involved in postgraduate studies. And in University of Batiklo, there were 25 students, and 10 of them are involved in postgraduate studies. And to see the statistics from my batch, in University of Rajarata, there were 180 students, and only 20 students are doing postgraduate studies. So somewhat similar to Kelaniya, but I hope these statistics will change from your batch onwards. So once you finish the internship, unless you migrate or resign and join the private sector, all the graduates will be absorbed into the Ministry of Health. And within the ministry, you can apply for different posts depending on the vacancy list. So either you can apply for a medical officer post, or a senior house officer post, or a MOH, or an additional MOH post, or a JMO post, depending on the vacancy list and your merit rank. So after the internship, you will be either ended up in a major hospital or other hospitals, or in the Provincial Director of Health Service Office, or the Regional Director Health Service Officers, or at the MOH office. In the hospitals, there are units with house officers, and there are units without house officers. So in the major hospitals, you will be directly involved in patient management. In preliminary medical care units and in divisional hospitals, apart from the patient management duties, you will have to do institutional responsibilities as well as the medical officer in charge. So if you are joined to the PDHS office or the RDHS office, you will have to involve in public health programs. And if it is the MOH office, you will be a health manager who will have to do a lot of work in the preventive sector as well as to supervise all the health categories under your staff. And sometimes in the post-internship list, there are posts such as relief medical officer or undesignated posts. If you apply to a post like this, then the director of the hospital has the authority to appoint you to any unit where there are crisis situations. So again, your rank and everything matters when you select these vacancies according to your post-internship lists. So just to brief about the hospitals available in Sri Lanka, due to the availability of the human resources and the infrastructure facilities in Sri Lanka, we have different categories of hospitals. We have 2 national hospitals, several teaching hospitals, provincial general hospitals, district general hospitals, base hospitals, divisional hospitals, and primary medical care units. So if you are appointed to a primary medical care unit, apart from providing the medical care facilities, you have to provide institutional management facilities as well. So now let's talk about the duties of a medical officer. So if you are in a primary medical care unit, you will have to play the role as the main healthcare service provider. But if you are in a teaching hospital or a provincial general hospital where there are consultants, then you will have to play a role of the intermediate care provider. Apart from that, you will have to function as an administrative officer, leader, and a supervisor. In the preventive sector, you will have to participate in health protection, health promotion, and disease prevention. And if you are involved in the MOH setup, you are mainly involved with maternal and child health and occupational and environmental health. So, how to become a successful medical officer? This is very important. So, to become a successful medical officer, you need to empower with hard skills and soft skills. And you need to timely achieve the grade promotions I mentioned before. And CPD plays a main role, and research and publications are compulsory. So, what are hard skills? Hard skills are related to the professional knowledge, tools, or techniques that allows you to work within the profession. So, hard skills are what we know. So I'm pretty sure that after the undergraduate training, now you have all the hard skills to become a good intern medical officer. At the end of your 1-year internship, you will acquire other hard skills that require you to become a good medical officer or a competent senior house officer. So next, soft skills. Soft skills are personal attributes that enhance an individual's interactions, job performance, and career prospects. Soft skills are who we are. So it is very important to acquire both the skills. Hard skills make you eligible, but soft skills make you desirable. What are the soft skills you need to acquire? You need to be a good leader. You need to be a smart thinker. You need to be flexible, and you need to have good interpersonal skills. And most importantly, communication. Today, we see and we hear a lot of obligations from the general public in social media. Our general public hates politicians only during the Aragala time. But the doctors in Sri Lankan population, doctors are all time their haters. They hate doctors so much. Sometimes it's exaggerated, but there's a truth as well. We need to accept that. Most of the time, it's due to the lack of soft skills. So I want all of you to be very familiar and to be thorough with these soft skills and to acquire and develop them throughout your career. And regarding the continuous professional development, it is the ongoing process of developing, maintaining, and documenting your professional skills. In other countries, this is compulsory for registration and for new appointments. But unfortunately, in Sri Lanka, this is not compulsory and not properly established. But with all the obligations from the general population, sooner or later, This will be established in Sri Lanka. So it is very important for you to participate in these activities. For example, if we take advanced life support skill programs, at least once in 3 years, you have to participate to these courses and update yourself with emergency management. These courses are conducted by different colleges, different clinical societies, and different conferences. So you need to participate and obtain the certificates and the experience as well. And not only the advanced life support courses, but the communication workshops, all these things, you need to participate frequently and update yourself. So people have described different CPD cycles, and to be very simple, it is you need to plan what you need, and then you have to do, and you have to record and review and reflect upon yourself. To briefly summarize, first you have to identify where you are and where you want to be in 5 years' time or 10 years' time. And then, according to your need, you have to plan. You have to plan how you can get to where you want to be. You have to have an idea with clear outcomes. And then you have to act upon your plan. And you have to be open to all the learning experiences. And then you have to reflect upon yourself with all these learning opportunities. And whenever you get an opportunity, you have to apply this and practice. And it is important to share these experiences with your teachers, with your colleagues and trainers, so that the both sides will be benefited. And at the end of the day, you have to measure the impact, measure the overall impact of your learning that has happened to your work. So by participating to different conferences, you will get CPD points. You have to collect these CPD points for registrations, and even if you're applying for any job in foreign countries, these CPD points are very important. So just after your undergraduate training or completion of your graduation, don't think that the learning is stopped or finished. I saw several of you sharing your graduation photos very proudly and publishing photos, but that's just the start. There are so many more years to go. So publishing photos is not the end. You have to do more work and you have to continue the learning. And there are several benefits of CPD. It will enhance your knowledge. You will be an up-to-date person, and in the team, you will be a more effective person. And regarding research and publications, it is very important to do research and publications. This will make you a critically evaluating person. And it has found that people who do research are better caregivers. So when you are in the Ministry of Health, you may think that it's difficult to do research. If it is in a university, it's easy to do research. That may be your concept, but it should not be an obstacle for you. So when you are in the Ministry of Health, what can you do? You can publish case reports or case series, highlighting and researching a unique or unusual case you treated. And you can conduct quality control studies on ways to improve patient outcomes. You can do audits, and you can do research using the patient database. And also, if you are in the MOH sector, you can do a lot of studies related to the maternal and child health concepts. So it is very important to do research and publications, and the Ministry of Health of Sri Lanka is actually facilitating medical officers to do research by providing a research allowance. Actually, this can give you some additional income as well, and you can get all the details from the Ministry of Health website. And that's about the Ministry of Health doctor's role. And I was asked to briefly describe about the role of the doctor at forces. So to become a doctor in forces, from the very beginning, from the University Grant Commission, you can directly apply from the military quota and join the universities as a military trained doctor. If not, when the vacancies are applied, if you are a if you are a doctor in the health ministry, you can resign from the health ministry and join the forces as well. So military doctor is a dual profession. You will be a doctor as well as a military person. You have to provide healthcare facilities, and you have a lot of administrative duties, and you have to take part in crisis situations in the country. And you can also participate in United Nations missions. And you have medical duties of very important people, including foreign delegates. And there are few benefits that a military doctor will receive rather than a doctor in the Ministry of Health. Some of them are, there are a lot of welfare facilities for the family where the Ministry of Health doctors will not receive. And upon reaching certain ranks, these military doctors are eligible for benefits entitled by military officers, such as vehicles and fuel allowances. So those are the benefits that a doctor in the forces will receive. So just before ending my presentation, I want to talk a little thing about work-life balance. Already the Dean Sir has talked about this. During my 8 years of experiences in the Ministry of Health, most of the time I have seen work is the least priority thing for doctors. Family, friends, fun, everything comes before. But I kindly request all of you, please don't do that. Make work a priority as well, because for you, a patient may be just another patient, but for the patient, you are a healer. You are a physical healer as well as a mental healer. So please you do your job properly with all the good qualities and be a compassionate doctor. That's what we need. And at the end of the day, always ask, am I going to be a great doctor? Thank you.